Feeling lightheaded or a little faint is a common symptom for older adults. However, although this feeling is not categorized as life-threatening, there are instances where it might be, and giving these symptoms proper attention with your healthcare provider is essential to maintaining a healthy life, not to mention having peace of mind. 1. Heart attack and stroke. Although lightheadedness can present itself to be non-threatening, there are severe situations that are associated with it, like heart attacks and strokes. Other symptoms of a heart attack often accompany the feeling of lightheadedness, including chest pains, shortness of breath, nausea, arm pain, back pain, and jaw pain. Symptoms suggesting a stroke are a sudden onset of headaches, numbness, weakness, visual changes, trouble walking, or slurred speech. 2. Low blood sugar. When you don't have enough blood sugar, every system in your body goes on reserve to use as little energy as possible, including your brain, making you feel lightheaded or confused. It can only take as little as a glass of juice to relieve your symptoms. However, it is best to check your current blood sugar levels, especially if you need more glucose in intravenous or pill form. 3. Sudden drop in blood pressure. The autonomic nervous system is in charge of regulating the shift in blood pressure when we stand up, but as we become older, this system begins to deteriorate and causes a temporary drop in blood pressure when we suddenly stand up, known as orthostatic hypotension, which can result in lightheadedness. Although this may become a long-term problem, there are medications available to treat it. Ultimately, visiting your doctor to determine which medicine best fits your situation is necessary. 4. Medication side effects. There are moments when certain medications may cause you to feel lightheaded, especially those that lower your blood pressure or make you urinate more. If they work too well, they'll lower your blood pressure too much and make you lightheaded. The solution? It is as simple as merely adjusting the daily dose or switching medications. 5. Dehydration. At times when we become overheated, it is likely because we are not drinking or eating enough. Without enough fluids, the volume of your blood goes down, thus lowering your blood pressure and keeping your brain from getting enough blood, which ultimately causes the lightheadedness. A glass of water may be enough to make you feel better. Depending on the severity of your dehydration, you might need an intravenous infusion of fluid. A doctor might also check to see if you need electrolytes like potassium or salt. Don't ignore it. Even if the lightheadedness does not have a serious cause, it could lead to serious injuries from a fall. And at the worst, the cause may itself be life-threatening. Start having a drink of water or orange juice and lying down. If the symptoms last more than 15 minutes, it is time to seek urgent medical attention. Even if the symptoms are brief, and even if you believe you may know the underlying cause, it's best to report the symptoms to your doctor.